This is a sperm granuloma. Sperm granulomas are caused by a foreign body histocytic and giant cell reaction to extravasated sperm. 50% of cases occur in the third decade, but they can occur at any age between around 18 and the early 70s. Around 40% of cases of sperm granuloma are preceded by a history of vasectomy, trauma or epididymitis, and approximately 1 to 5% of patients who have a vasectomy will go on to develop a sperm granuloma. They present as painful, firm or hard swellings affecting the head of the epididymis, cord or occasionally the testis, and around 90% of cases of sperm granuloma following vasectomy are in the spermatic cord. A sperm granuloma is typically a white or yellow nodule or nodules up to around 3 centimeters across. Histologically, there will be an inflammatory infiltrate composed of neutrophils, lymphocytes, histiocytes, and giant cells. There is usually some necrosis, and extravasated sperm are seen in the early cases. This is followed by fibrosis, and eventually the sperm become replaced by yellow and brown ceroid pigment. Here is the cut surface of a testis, and the solid whitish lesion at the head of the epididymis is a sperm granuloma. Histologically, the tubules in the epididymis are distended by sperm, and at the top of the picture you can see how the sperm have extravasated into the soft tissues of the epididymis. And at a higher magnification you can see the granulomatous inflammatory infiltrate associated with sperm composed predominantly of lymphocytes and histiocytes, with occasional giant cells. In this field, the sperm have disappeared, but what remains is the golden brown ceroid pigment.